Good afternoon. So the paper I'm talking about today is about advancing a social justice agenda in health professions education. And it's specifically about designing curricula which are responsive to health equity concerns in this country, but also about delivering future healthcare professionals who are not just clinically competent, but also critically conscious of the context within which they'll be working one day and the health systems within which they'll be practicing after they graduate. So we're drawing on Paulo Freire's concept of critical consciousness, and we understand this to mean developing health professionals who not only question the causes of health inequity, but also in their work intervene in the systems and the contexts that they find themselves with a view to transforming them into more socially just spaces. So the basic premise of this study is that disease is managed in a context, in a system, and therefore addressing issues of equity and social justice needs to become part of how future healthcare professionals are educated. So this has implications for the healthcare teachers. So we gathered data from academics and clinicians teaching on the MBCHB as well as the physiotherapy programs at Stellenbosch, and we explored their views on this issue. So all our respondents agreed that their curricula needed to be socially responsive and address issues of equity and social justice, but there were differing views among our respondents about the relative importance of clinical competence and critical consciousness. So the clinicians particularly felt that clinical competence was more important and more emphasis needed to be placed on this, while other respondents saw the development of critical consciousness as being equally important. What we're arguing in the paper is that knowledge beyond bioscience is needed in the training of all health professionals. And so both bioscience and social science are legitimate knowledge bases, and that through those knowledge bases we need to develop both clinical competence and critical consciousness in future healthcare professionals. Thank you.